I am Sharon Clark. I'm a registered vascular technologist with Treasure Coast Heart and Vascular, and today we're going to be demonstrating a lower extremity venous ultrasound. We are checking for venous incompetency with the vein. Normally, patients will come in with discoloration of their legs, or they may come in with ulcers, typically venous ulcers, and we check to make sure that those veins that's in the lower extremity, that they're not having any reflux in their veins, which will cause those symptoms as well as swelling in their lower extremity. So today I am checking the lower extremity calf for reflux. I'm looking at the greater saphenous vein. I'm looking at it in transverse mode, and I usually go in sagittal to make sure that the patient doesn't have any reflux. So I'm going to go ahead and add color, and then I always compress to see if I see the reverse flow. We have a patient today that is not demonstrating any signs of reflux. So I'm going to go ahead and go in the transverse mode again, and always check all the way distally. So this vein is the posterior tibial vein, and the greater saphenous vein is always anterior to that segment. So I'm checking again, and I do not see any reflux in this patient. This patient is asymptomatic, but usually you will have a significant reflux in a patient that has any form of discoloration, leg swelling, varicose veins. This would show significant reflux in the greater saphenous vein. When a patient is diagnosed with chronic venous insufficiency, the treatment for that is endovenous radiofrequency ablation. If we find any varicose veins, especially the bulging varicose veins, then that treatment is ambulatory phlebectomy. That's when the doctor go in and remove the vein. If the patient has any spider veins, the treatment for that is sclerotherapy, and it's performed here at Treasure Coast Heart and Vascular by a board certified vascular surgeon and a registered nurse practitioner.